Hi y'all, today we're going to learn how to do CPR. I'm Edith. First, we're going to check if we're in a safe environment or if it's dangerous. We're fine right now. We have our patient here. Second, we're going to check if our patient is responsive. So as we can see, our patient is not responsive right now. So now we're going to ask anyone who is around us or call 911. So yourself or someone else can call 911. Fourth, we're going to check for breathing. Is our patient breathing? No. So now our job is to start CPR, okay? Okay, so now for this process, we're gonna do start compression. So you're gonna hold your hands together like this, and then we're gonna put our hands held right here close to the chest line underneath the nipple line. So now we're gonna start our 30 compressions. During this process, you're gonna do your compressions from no greater than 2 inches, okay? And this should be, these compressions are about 100 to 120 beats per minute. And then during this time, we're also going to make sure that our chest compressions are recoiling, okay? Alright, so now our CPR compressions were not working, so now we're going to focus on our breathing. So with this, we're going to tilt our patient's head back. We're going to have one hand opposite tilt with the head on top of the forehead, and then with our opposite hand, 2 fingers, and then we're going to put those 2 fingers under the chin, and then we're going to tilt it back. With this process, we're going to do our breathing, give 2 breaths within 10 seconds, all right? So now we're going to hold the nose and then start our breathing. And now we're going to check if they are breathing again. So now we're going to start our CPR again. Remember, 30-second compressions, no greater than 2 inches, 100 to 120 beats per minute. Our compressions didn't work, so now we're going to do our AED. So if there's an AED nearby, get it, all right? So the AED comes with pads. It has direction of where to place them. Grab one of them. One of them we're going to put below on the left area near the abdominal, lower to the chest. The other one we're going to place it on the right side, on the chest here area. And now we're going to turn on the AED, and it will direct you with directions on what to do.
Do not touch the patient.
Do not touch the patient.
Shock advised. Charging. Stay clear of patient.
Make sure no one touches the patient.
Deliver shock now. Press the orange button now. Shock delivered.
Alright, so once we...
Begin CPR.
So now we turn it off, the AED, and we take off the pads and immediately start our CPR compressions again. Remember, 30 compressions per 2 breaths. Do this for no greater than 2 inches, and then 100 to 120 beats per minute. Additionally, there's also different barriers that you are able to use during giving CPR. One of them is this mask, the facial mask. So you're going to put it over here, over the nose. With this comes a mouth guard that you can combine, put on, and now that's one of the mouth barriers, okay? Another one comes, this is a facial mask that you can put over and start your compressions again. Remember, if you don't have these these barriers, you can start CPR. Just focus on the CPR compressions. All right, thank you.